In the world of sports, distance vision is crucial to calling the plays and knowing your next steps. The technology of light adjustable lens can help our local players and our sports broadcasters do just that. The team eye doctor for both the Phoenix Suns and the Arizona Diamondbacks is using the very latest innovative technology to improve precision on and off the field. We are here with Dr. Jay Schwartz of Schwartz Laser Eye Center and TV broadcaster for the Phoenix Suns, Kevin Ray. Hello to both of you. Thank you for being here.
Thanks for having us.
Dr. Schwartz, I mean, that's a big job, being in charge of all these really important people who we want to win. So no pressure, right?
No, it's just, do what I do. Just help them see a little bit better.
And tell me about this new procedure. What is it called and what does it do?
This new procedure is done does a couple of different things for patients who want to have better vision but don't have cataracts, and they're over the age of about 48 to 50, they can have a lens replaced in their eye and have the ability to see well far away, have the ability to see computer, have the ability to have some reading vision, and it's a permanent fix. The light adjustable lens is just that, it's adjustable. So after it's been implanted, we wait for the eyes to heal, and then we can go in and fine tune it and dial in the vision to exactly where they want it, and then lock it in, and it should stay the rest of their lives.
What are you doing when you're making these adjustments and then locking it in? What does that mean?
The adjustments are actually simple. They use ultraviolet light to go in and reshape the lens that's been implanted and give it the correction that we want it to have.
Mm-hmm. So of course we want to think about things we're familiar with, like LASIK or even a hard contact that is placed in the eye.
Yes.
How does this relate to those?
Yeah. Well, with LASIK, you're operating on the cornea, the front part of the eye, and it helps reshape the eye and give you better vision. But LASIK loses the ability to help you up close unless you do what we call monovision, where one eye reads and one eye sees far. So LASIK's great when you're younger and you still have that ability to accommodate and read. But as we get older, we lose that ability. So oftentimes we find LASIK patients have to make a choice. So they can lose that reading vision to see better far. But with lens replacement, they don't have to do that.
So Kevin, what were you thinking when you're going in for this surgery? What was that procedure like? What was the operation like?
I mean, the procedure itself was incredibly easy. We were joking, like the prep time leading up to the procedure takes longer than the actual procedure itself. It is quick, it's painless, and the recovery time, extremely quick. And as Dr. Schwartz said, there's a matter of adjustments that we make. I've got my third and final adjustment coming up this week, but literally within a matter of 2 weeks, I had ditched the glasses completely.
Okay, so we're looking at a little video here. So when you did have your operation, is it an operation, procedure? What do we call this, Doc?
It's an operation. It's actually the same procedure as somebody who has cataracts.
Okay.
And we do it for patients who have cataracts, and insurance actually helps cover some of the cost. If you don't have a cataract, it costs a bit more. But it's basically like a cataract surgery, but a little bit simpler when there's no dense lens in there.
And Kevin, you were starting to struggle with your eyesight on set, and that's annoying, as we know. What made you decide to do this?
Yeah, for me, because in addition to calling the Suns games, I also do NFL games, and it's a combination of using binoculars. And in NFL stadium, you're much farther away from the action. My distance vision was not bad, but it was really the biggest challenge had become reading the game notes that all of us broadcasters have to help prepare for the games. And I think as we can all, relate to, menus in restaurants, the font gets smaller and smaller and smaller.
Those glasses that have to come out.
Yeah, and I had used glasses the last couple of years, and I certainly could have stuck with that. But in talking to Dr. Schwartz and knowing him for 20 plus years now, knowing the work that he has done, and knowing that this procedure would set me up for the rest of my life, it was one that was pretty easily made.
For folks who might be squeamish about having surgery on their eyes, what would you tell them?
I would tell them don't be squeamish at all. I mean, honestly, it is painless. He's got a wonderful staff, brand new facility, I might add, which is just state of the art. But you feel nothing, and it is very light anesthesia that they put you under with. You're in a matter of minutes, and you're out. It's an outpatient procedure, and so anybody that's got any reservations, feel free to reach out to me. I'll be happy to walk you through it, but no, painless.
How has it changed your vision and your work?
I mean, it has been, to pardon the pun, it has been a game changer. Like, as I said, literally within 2 weeks of the first eye being done, I had ditched the glasses completely. And I'm now, you know, a month and a half into the NFL season, NBA season just getting started, have not used any glasses whatsoever for almost 2 months now.
And are your lenses locked in yet?
Not locked in yet. We've got one final adjustment that we're making on Wednesday. And, but, you know, I'm excited about getting that done and then knowing that it is complete. But even before we get to this last adjustment, I'm beyond thrilled with the results.
Yeah, happy to have it. Awesome. Thank you so much for your testimony on this, Dr. Jay Schwartz. Thanks for keeping our athletes and all our folks seeing very well. And I know you've been doing this for how long here in the Valley?
I've been here since 1997.
Wow. So you're
My
definitely
25th year with the Phoenix Suns.
Congratulations.
Thank you.
Very cool. And our eye vision and our eye health, so important. Thank you to both of you. Shining a spotlight on our tribes on Indigenous Peoples Day.